Hello everyone, welcome back to my channel. I'm your Rosie. Today we are going to discuss about Oman prometric questions. It's very important questions. So I'm making a video part by part. So today we are going to start first part. First question is, all the followings are the types of spina bifida except meningomyosal, hemophilia, meningocele, spina bifida occulta. The answer is hemophilia. Second question. During pregnancy, in iron supplementation starts on in second trimester, third trimester, or first trimester? The answer is second trimester. The usually first trimester they will start folic acid supplementation. So in second trimester they will start iron supplementation. The third question is, you heard a nurse talking to a doctor and he said, the patient has macrohematuria. What he means by hematuria? The options: the patient cannot urinate or difficulty in urinate, the urine seems bloody, difficult of breathing. The answer is the urine seems bloody. The blood stained urine called as hematuria. Fourth question. Health teaching to a diabetic patient will be on about what you are going to teach. Okay. The options are about complication, about diet, insulin, exercise on feeding, or diet, hypoglycemia, exercise and feeding, or diet, oral hypoglycemia, weight loss, feeding. The answer is diet, hypoglycemia, exercise and feeding. Option C. Question number 5. Order. Delsona 7.5 mg now available. Deltasor 2.5 mg score tablet. How many should you give? The answer is 3 tablets. So here I given a drug calculation formula, that is strength required divided by strength in hand into volume of stock divided by 1. Question number 6. A nurse makes a home visit to a patient recently diagnosed with chronic obstructive pulmonary disease, that is COPD. Which of the following should the nurse teach the patient about managing COPD? Options: recognize signs of impending respiratory infection, limiting fluids intake, minimize bronchial secretion, correct technique to auscultate the lung fluids, importance of starting antibiotic therapy. The option A is correct, recognizing signs of impending respiratory infection. Question number 7. A 3-year-old has returned to the clinic 4 days after being diagnosed with gastroenteritis and dehydration. A patient reports that the vomit has stopped and the child is tolerating liquid, rice, applesauce and bananas. The diarrhea persists but seems to be decreased in volume. When evaluating of signs of dehydration, the nurse will assess the patient's skin turgor by option: grasping the skin over the abdomen with 2 fingers, raising the skin with 2 fingers, or option B, grasping the skin over the forehead with 2 fingers and raising the skin with 2 fingers to 2 fingers. Option C. Holding the patient's mouth open and assess the tongue for the deep as these cases or furrows. Fourth option. Drawing two tubes of blood and running blood, urea, nitrogen and creatinine. The option A is correct. Question number 8. A nurse administers a albuterol nebulization on a child with asthma exacerbation. Which of the following indicates effective of the treatment? Option Option A. Adventitious breath sound with cough. Saturation is 94%. Nasal flurry. Respiratory rate is 28. Option B is correct. Question number 9. The nurse is caring a 4-year-old patient with the diagnosis of cystic fibrosis and pneumonia. The child is feeling better on the 3rd day of the hospitalization and wants to play. What should be the best choice of entertainment? Option A is bowling, bubbles, looking at the pictures book, watching videos, reading in a wagon. The option A is correct one. Question number 10. A nurse is caring for a child with a diagnosis of cystic fibrosis and pneumonia. The plan of care includes nebulizer, treatment and chest physiotherapy. The nurse should perform chest physiotherapy. Option A. Continuously during the nebulizer treatment. Option B. Prior to the nebulizer treatment. Option C. After the nebulizer treatment. Option D. Intermittently during the nebulizer treatment. Option C is correct. Question number 11. The nurse is caring for a patient who had major abdominal surgery under general anesthetic 4 hours ago. An appropriate goal for the patient including options A. Having minimal fine calculs in the base of the lung using the incentive spirometry every 4 hours. Option B. Expectorating minimal amount of secretion. Option C. Performing coughing. Option D. Exercise every hour while walking. Option D is correct. Question number 12. While carrying a child with a ventriculoperitoneal shunt reversion, the nurse finds the patient lying with the head and feet flexed back. The nurse should call for help and prepare for a options spinal tap. Option B. Shunt culture. Option C. Electrocardiogram. Option D. Ventricular tap. Option D. Ventricular tap is correct. Question number 13. A nurse is assigned to do a home visit for a 81-year-old patient. The patient lives at home with an adult caretaker and he completely bedbound following a cerebrovascular accident 2 weeks ago. In planning caregiver education, the nurse should be prepared to instruct the caregiver in options A. How to select a nursing home for the patient. Option B. Performing passive range of motion exercise. Option C. The importance of avoiding viscous drink. Option D. Forming a local chapter of a caregiver support group. Answer is option D. Question number 14. A home health nurse visits a patient with diabetes and primary open angle glaucoma. The patient takes metformin 500 mg once a day for diabetes and timolol ophthalmic solution twice a day in each eye for glaucoma. Which of the following evaluation indicates that patient is non-complicated with glaucoma management? Option A. Patient has been taking glycopage. Option B. Patient has tears of eyes. Option C. Patient has not refilled prescription for timolol in 3 months. Option D. Patient has yellow discharge from the eye. Option C is correct. Question number 15. The nurse is teaching a mother of a 3-month-old infant about bottle feeding. Which statement indicates the mother understood of appropriate procedure? Option A. I should hold my baby in a slightly reclined position close to my body. Option B. It's okay to prop the bottle on a pillow. Option C. It can feed my baby whole milk. Option D. I should warm the bottle in microwave if they come out of the refrigerator. Option A is correct. Question number 16. A 58 years old man admitted to the ICU unit have rapid and irregular heartbeat, swelling, edema in legs, ankle and feet, fatigue and weakness. After assessment, the test results normal value magnesium is 2.8, which on ECG changes is the nurse expected to note? Option A. Multiple P waves, prominent U waves, prolonged QRS, depressed ST segment. Option C. Prolonged QRS is correct. Question number 17. A newly graduated nurse is inserting an intravenous cannula into the mild cephalic vein of a patient who is being admitted to the unit. As she withdraws the needle, a nurse calls out for help from another patient room. The new nurse rushes to help. She secured the intravenous catheter and throws the needle into waste basket instead of the sharp container. When asked who had thrown the needle into the bin, the new nurse admits that she had made that mistake. Which professional act best describes the newly graduated nurse response? Option A. Responsibility. Option B. Accountability. Option C. Assertiveness. Option D. Leadership. Option A is correct. Question number 18. Education patient post vaginal delivery for breastfeeding and engorgement. Option A. Mother breastfeed 2 to 3 hours at a day and night. Mother breastfeeds via bottle at night. Option C. Mother breastfeeding 2 to 3 hours at a day, just never to night breastfeeding. Option D. Every 1.5 to 2 hours during the day and at last every 2 to 3 hours at night until engorgement is gone. Option D is correct one. Question number 19. The primary difference between the practical nurse licensure and a nursing certification in an area of practice is that nursing licensure is option A, ensure competency and a nursing certificate validated years of experience. Option B, mandate by American Nurse Association and a nursing certification or not. Option C, is legally mandated by the states and a nursing certification is not. Option D, renewed every two years and a nursing certificate is renewed every 5 years. Option C is correct. Question number 20. A 5-year-old child was brought to the emergency room with a fractured right forearm. He had several bruises on his body but showed no signs of pain while palpating them. He seemed scared and did not answer any questions. Why should the nurse discuss the case with the nurse manager? Option A, continuity of care. Option B, rule out child abuse. Option C, psychological support. Option D, fracture management. Option B, rule out the child abuse is correct. Thank you for watching. Please subscribe and share the video. Thank you.